Yes, yes, yes. Thank you, everybody, for hanging out till the end. So far, so good. I hope we can keep your interest, and I hope that you will remain engaged and help us with some of the questions that we've prepared today. I'm glad that Dr. Shu is on the call with her team. This actually originated because of a talk that she gave to the DARE Cab from the Martin Delaney Collaboratory on Cure Research about the same presentation that you saw just now. So terms were used like sterilization and other terms. The sterilization is particularly offensive to me. It reminds me of Nazi experiments. Dr. Shu and I are friends. She's one of the most community-friendly researchers that I know. And we talked about these terms via email, but we talked about them. And she actually made great points in that a lot of the terminology that we complained about were what all the doctors use, just like they used to use subjects, like research participants were little rats. So we were very successful at getting that terminology changed to participants. And I thought, Karine and I have talked about this at length, and we thought that it would be a great opportunity to bring some of these terms to your attention and to get your opinion on some of the things we used to use, we need to use going forward instead of what things we used to use. Sorry. Anyway, I think the sterilization thing is a no-brainer, but some of the other stuff gets a little bit more complicated. So I'm going to come back at the end of Karine's presentation and talk about some action items. In other words, recommendations about where we go from here and how we can continue to interact on this so we can actually, move the needle on this. So next we will have Karine with some slides on this. Karine Dube, our social scientist extraordinaire, who is an honorary community member, one of us for sure. She's on the DARE Cab and has been involved in, I can't even tell you how many social science papers about cure research that, that's what doctors look at. That's what researchers look at. That's what drives them. So it's important to get this stuff published so we really can move the needle among the community and among the researchers. So without further ado, Karine, go for it. And Karine has some interactive questions within her presentation.
Thank you, Lynda, and thank you all for staying until 1 o'clock. I also would like to acknowledge Michael Luella, who has helped with this presentation today. So we want to engage into a conversation around some of the terminology that we use in HIV cure-related research. So the first term that we would like to talk about is the term sterilizing cure or complete elimination of HIV from the body. So what comes to mind when you hear the word sterilizing cure? You can either type it in the chat or raise your hand and share your thoughts. We want to hear from you. So Michael Luella said eugenics. Mm-hmm. That a person is unsterile or steriled. Nazi experiments, okay, great. So definitely it brings to mind connotations around disinfection and cleansing. Also forced coercion, forced sterilization of women that have happened in Latin America, Africa. This is an article that was published in February 2020 about 48 women in South Africa that were sterilized against their will. So the words that we use are definitely important. And so we would like to hear your thoughts about whether we should use HIV cure, sterilizing cure and HIV cure research. I think we have a poll question, Michael.
Oh, so everyone will see it there. There's the question, and it's a multiple choice. You get one choice for an answer. Please take a chance and vote for us. Vote for one of these answers. Let us know. Still have people coming in, still having votes come in. So we have about 35 people who've signed or filled out the questionnaire so far. We have 66. Can we get it higher? What do you think? Should we use sterilizing as a term? The answers are yes, sometimes, no, never, it depends, or I don't know. So we've gotten up to 40. We got about 2/3. Can we squeeze a little bit more? Give us an answer. What do you think? All right, I'm going to end the poll. I'm going to end the poll in about 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So we're ending the poll, and now I'm going to share the results with you. Do you all see those?
Yeah.
Looks like we have about 60% saying no, never. We have some people saying yes, sometimes. Some people saying it depends. What would it depend upon? That's what I'm curious about finding out. You can unmute yourself if you wish for this portion. Please feel free to share your voice directly or type in the chat. You're free to unmute. Share your voice.
I personally don't like that when you're speaking of cure and looking for things to prevent, using the word sterilized. Even though it can't, I voted no. I'll be public about that. But I just still think that with so many other things going on that cripples people's thinking and harms people volunteering to be part of research, that word is so strong and so negative that I think it defeats the purpose of trying to get someone to do it. And then that opens up so many other doors and questions. I'm like, well, if you're using the word sterilized, we're going to go back 40 steps. And we're trying to go ahead. And then, then that brings in to play the finance. We spoke earlier, the financial aspect of it. Well, they want me to do this. They should be paying us this, and they aren't doing that. So personally, would I use that in cure research? No, I wouldn't.
Thank you, William. That's great. I love that. And you had a lot of people in the chat agreeing with you. So that's
thank you all.
Yeah. Bill Freshwater asks a question. Would eradication cure or an eradicating cure be a better term to use?
Can I give me my opinion from
Sure,
my
please, go ahead.
basic researcher position? Well, I'm a basic researcher and a specialist in microbiology. So in microbiology, when we say that something is sterile, it means that it's free of a microorganisms. So it has not like a negative connotation for us. But I perfectly understand that in other areas, for example, in reproduction, saying that someone or some animal is sterile. And of course, as William, I think, said before, in some other areas, it might have a very, very negative connotation that I perfectly understand. But of course, for example, in the anal publication and when we, in the HIV cure research, when we all refer to a sterilizing cure, of course, we are like trying to, the message is that a sterilizing cure is a method or a process by which the HIV virus is eradicated.
Mm.
I really can't say, I'm not sure if eradication or sterilization are the same word. I'm not an expert on that. I cannot say that. But, well, this is my position from, again, my basic researcher background in microbiology.
That's wonderful. Andrea, I see your hand is raised. Do you want to unmute yourself and have share your thoughts?
Yes. Maybe I'm thinking about it a different way, but when you think about Black and brown people, usually in history, when you see the word sterilization, it has something to do with taking you right away from having children. Mm-hmm. Now, the usual average lay person does not understand medical terminology or understand what you mean or are implying when you have the title to a study. So if you're trying to get them to buy in to the actual study and the work that you're doing. You can't come at them with something that's going to scare them off from the get-go, and they are yet an important part of who you're trying to draw in. So as soon as they see that word sterilization, already they have shut the door, put 3-4 locks on, as if they were living in the Brewster Projects, and you're not getting in.
I wholeheartedly agree.
And I can say that from someone who has been a part of that community that wasn't buying in. Yes, I work for the Philadelphia Health Department, but at the same time, I don't buy into everything that they send my way. And I was one of those people that when I first saw the thing about the COVID vaccination, it took some actual me doing some research to get.
We have some background noise. Hold on. Could you make sure you're muted if you're not talking? Sorry about that.
That's okay.
Okay, go ahead. Finish your thought, please.
When the COVID vaccination came out, I was adamant about not getting it because I'd had no understanding. And the lingo that they were putting out was not selling it to me. Even though it was valuable and important, it was not selling it. And I was scared. But when we come to talk about HIV, we cannot scare them before they get in the door and expect them to buy anything that you're selling.
Amen.
And that's fabulous, because if you want 50% women in that study and it says sterilizing anywhere, I think that the doors that Andrea talked about are going to be shut right in your face.
Kate, you had a question or a comment. Please unmute yourself and share.
Yeah, just on the sterilization. When I hear the word sterilization, I think of something coming off a machine sterile enough to go into a package. Or taking your kitchen utensils and sterilizing them, or like one other person talked about with the Black community and sterilization, it's just a very negative word, and the average lay person, just like myself, even though I know a lot of these terms from being HIV positive and dealing with research and asking questions. I still am shy when certain words are used. I was shy for the COVID vaccine for that reason. I had to reach out to several people in my community that was working around the vaccine just to understand the terminology that they were using and understanding how it's supposed to work. So you got to understand when going into these research studies, not only the population you're dealing with, but the words that you're using. The words mean a lot to everyday lay people.
There's connotations and denotations to every word, and the connotations around sterilizing to me are very fraught with negative outcomes. I mean, it's just horrific. When I hear the word sterilizing being put to human beings, I don't think anything good of it. I don't think, oh, good, you're cured. Sterilized, you're cured. I think, oh, sterilized means we did something without your consent to stop you from being able to reproduce.
Exactly.
Yeah.
Exactly.
Cliff, you had your hand up. Did you want to comment?
Thanks. As a Jewish person, I have sterilization, of course. Somebody mentioned earlier about Nazi Germany when they were trying to, cure the Jewish race of that we were terrible. So whatever. But the idea of a name, it should be palatable, digestible, easily to the public so that we can enroll as many people, and also so that it makes sense to the scientists, the scientific community. I don't have the name yet, but I think if we put it on a poll, we probably find a good name.
Right. I think someone
Karine,
in the chat.
is that like a segue for Karine with the next?
Yes.
Thanks.
Go ahead, Karine.
Great, thank you so much. This is exactly the type of conversation that we want to have. So let's move on to the second expression, that of functional cure, which would be a durable suppression in the absence of treatment. So we want to hear your thoughts. Do you think the word is meaningful? Do you think it's used consistently? Can you visualize this functional cure? We want to hear your thoughts.
Do you want me to launch the panel?
Drive shift. And some of you.
Well, here, I'm just going to put it up here. About functional cure. Should the expression functional cure be used in HIV cure research? So please take a chance and vote on one of these just to see where you may
Really quick,
Oh.
Cliff, is that your same hand or do you have another hand up?
Thanks. I'll take my hand down.
Absolutely. Thanks so much.
All right, we got 26 people so far voted. We have 63. Let's try to get it up to 40 at least. What do you think about the word functional cure, the phrase? Do you think we should be using things like that? Do you even know what it means?
I was just going to say, maybe Karine, you could explain a little bit the difference between total eradication and a functional cure. And then we
Yes,
have some examples coming up in the next couple of slides.
So there are two paradigms that are sometimes referred to. The first one is completely eliminating HIV from the body, what we've seen with the Berlin patient, Timothy Ray Brown, or Adam Castiero, the London patient. So that is the first kind of paradigm. The other paradigm that we refer to is functional cure, or this would be still having virus in the body, but being able to keep the virus under control or suppressed for a long period of time in the absence of therapy. We sometimes also use the expression post-treatment control. I think we heard the presenters before use that expression. So how are we doing with our poll, Michael?
We are at 39 people so far. Let's get it up over to 40. You can easily choose I don't know or it depends. No, never, yes, sometimes. Those are all the choices. Can we get a few more votes there so we can get at least 2/3 of our people? Give us a vote. We won't hold it to you. We won't hunt you down afterwards. All right, I'm going to close the poll in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And I'll share the results with you all. There you can see. We have the majority with saying yes sometimes. It'd be interesting to hear from people, what do they mean by that? What are those sometimes?
Words are very contextual. So when can we use functional cure? When should we not use functional cure? We want to hear your thoughts.
So for me, I think that it's the same thing as what we were talking about before, which is language and who the language is directed towards. If we're talking about a functional cure and you're someone in research or you're someone who is in medicine, then you know what that means. But if we're talking about the average layperson, you end up spending more time trying to explain what it is than people just simply being able to absorb the benefit and understand what you're talking about. So I think it creates it's like creating a language barrier. Even if you speak the same language, it's like speaking Chinese or Italian to me, because I don't speak either of those languages.
And the potential for misunderstanding just grows.
Exactly.
Yeah. I always, when I would use that term and having to explain it to people, I really kind of did it really simplistic. I almost said functional cure means, quote unquote, like a cure. It's like a cure, but it's not a cure as they would be thinking about it. So it's like almost approaching a cure, but not really what they would be thinking. Because people think a cure means it's totally out of my body. It's totally not a problem. And functional cures are not that. And exactly, I love how Patricia said, but who wants like a cure? Who wants a functional cure? Some people look at it as a time bomb. Any other thoughts about functional cure? Or should we move on?
I have a comment.
Go ahead.
I think the more we do things like we're doing now, by having the researchers and medical people meeting with us laymen and having things like this, you will be able to use more, because there's more educational things that are being done to make us aware of what's going on and how functional these words and interchangeable they can be. But if you don't understand them, like most documents, if you don't attend a bunch of meetings, there's no glossary to them. I know when I first came on to the MDC for 7-8 months, I didn't know what nobody was talking about. It was all German to me. But the more that you're around it and you hear it, and then if you aren't afraid to ask the question to do that. Or like I would tell them, you know, I've helped do things, but I'll say, well, I'm green. If you're willing to teach me, I'm willing to learn. So that goes both ways. So by having researchers like you all that are here willing to teach, because that's your job, to teach us so we can help you. If you're able to help to teach us, your dreams become our reality, and then your dreams become part of our dreams. So it's a back and forth thing. So if you're willing to teach, people are willing to learn.
Amen. Christine, I see you had your hand up.
There, yes, I'm trying to unmute myself.
There you go.
As far as everything goes, like with the functional cure, like you said, yeah, I'd rather it be a cure. But they've been saying now, you know, that it's because it's manageable and it's not life-threatening. They've taken the status down to a different degree and everything like that, to where it's almost like it's already considered a functional virus. So I would, you know, to see the cure part of it, it'd be great, but I'm just wondering, you know, I think someone mentioned that it would be for people that just got it or more likely to be cured, the more recently diagnosed. But I always think of it.
Yeah, no, I exactly. It's definitely a pretzel that we need to think through, because people's potential participation, as well as just their general understanding of what is going on in the field of cure, depends upon the way we talk about it, the words that we use, and we need to have a sort of more united front. We're not always speaking to other scientists, and in most cases, like for me, I am speaking to community more than to scientists, and so the words that I feel need to be used need to be really thought through, because people will take headlines and make headlines out of these bad terms or these indeterminate terms, and that will be left to interpretation for other people. Karine, did you have other examples you wanted to go through?
Not at this time, but we have a great comment from Dr. Hugh in the chat. Maybe Dr. Hugh could provide a scientist perspective. You're on mute, Dr. Hugh.
Thanks. Sorry, I'm trying to finish the second part of what I'm trying to, what I'm thinking now after many discussions with Michael and Lynda in the past. So I think we can really, now we have so many cases, there is really a cure of HIV infection, which the example that through either stem cell transplant or through natural immunity, basically all viable, or you can say functional or intact HIV that all eliminated, either through medical intervention or through their strong immune responses. So they are cured of HIV, and the chance that they're going to have any viral replication in vivo in their body probably is minimum or zero. Obviously, as we mentioned, we need to follow up many of these individuals for long term. But the other definition that's similar to the functional cure is that was mentioned, could just mention as drug-free remission. So either you are naturally controlled, like ED controllers, or after treatment interruption, like post-treatment controllers, you do not need treatment, but you can suppress viremia for a prolonged period of time. We don't know exactly how long that could be. For ED controller, we have people up to 30 years now. They never had viremia, but they do have virus. They have perfectly intact virus. If you culture their cells, virus can grow out. But in their system, it doesn't bother them anymore, because we, as Michael posted earlier, we defined their virus is in the genetic location that don't have the machinery, don't have the tools for them to come out in vivo anymore. But if you go take them out, kick them, they will grow. So they're perfectly functional, but they are not doing any harm in the human body for up to 30, 35 years. So those are drug-free remission of HIV infection. That's what the majority of the research that we actually can aim for bringing people to that status. That means after 20, 25 years of treatment, you may be off treatment for many, many years. Yeah, that's what my take on this.
I see Mike raised his hand. Did you want to add a comment?
Yeah, this is Mike McCune. I'm not sure if I'm on camera or can be heard.
You
Is that
are.
true? Oh, good.
Yep.
Okay. I just wanted to, chime in and maybe not provide consensus on the scientific viewpoint from what you just said, but to elaborate to say that something has been totally eradicated. So that term, for many reasons, is not appropriate in this discussion. It is common, though, in cases, for instance, for other diseases like cancer, to talk about remission. And you talk about remission for a period of time, and it's a 3 to 5 year remission, and then numbers are gathered. And that's the way that I'll use the term HIV cure work will continue. We'll be looking for, as you just said, antiretroviral free suppression of HIV, which will be good for those who cannot get antiretroviral therapy and or who cannot stay on it should they be able to get it, which is actually true for the predominant population of people living with HIV around the world. And I think I was the one that I indicated functional cure could be used at times. And I reached out to Karine to figure out exactly which times. if one can define it later. Like if the headline is, a functional cure has been achieved, and then the body of the paper can say what we mean by this is the following: antiretroviral-free suppression of HIV or remission of HIV. I think that's probably in the way that our publications go. It's a compromise. It's not satisfactory. It would be best to put in. We have a Skunk Works where I work. We call it the SVSWG, the Sustained Viral Suppression Working Group. Which is another term, right? Anyway, I just wanted to throw that in. Thanks for having this discussion. I think it's incredibly important.
Thank you for sharing
Mike.
with us. Really appreciate it.
We like the term. A lot of us like the term remission. It's a very neat shortcut answer that most people are familiar with in the research community and the HIV community.
Yeah.
But there were a lot of people early on in the HIV community, at least in the United States, that didn't like the connotation of that. It reminded them of a cancer. We don't have cancer, and that sort of thing. So, and then somebody made the point that if you talk about durable suppression and 4 more words, that in Swahili it's like a yard long. So that's why we really have brought this to the group to try and figure out what's something that might work for everybody, including the docs, because Mike, what you put in a research paper is how researchers talk thereafter. So we're going to have to get research. We're going to have to get something that works for them too.
Yep.
But that also they're used to using like participants instead of subjects, because that's going to spill out. Whatever terminology they use is going to spill over to the way language used in protocols, terminology used when in talking to potential participants. So, it really is not just it's a long sort of road there and journey that we need to be kind of uniform about, in order to have the community come along with us for this stuff.
Right.
Michael, is there time I can make one other point? Maybe
Sure, go
even a
ahead.
challenge to the community thinking about words.
Sure.
So remission in cancer means, you don't have it for a certain period of time, and then it might come back, or you might get another. We thought of Timothy Ray Brown as being cured of HIV, and he didn't have to take his antiretroviral medication, but he still took PrEP, right?
Yeah.
He had switched 3 drugs for 2, and that's not a viable solution for the worldwide pandemic where people can't get any drugs at all. So what we're aiming for, at least, I think a worthwhile goal, although maybe, it's too aspirational, would be to have an intervention that would lead to an antiretroviral-free remission of HIV disease that would also provide protection against new infection, so that one did not have to take PrEP in order to prevent infection anew. And that's, if you can come up with some language for that, Karine, whoever, that's what I would love to see, because it's different than remission, it's different than eradication. It's not just protection, but it's both, actually, remission and protection.
Drug-free survival and prevention.
Yeah, just a few more words to add.
But at
But
least
Karine-
they're words that everybody understands. You know,
Yeah.
that's
Yes.
what we're
Good.
aiming
Love it.
for.
Thank you. I'll shut
Karine,
up.
did you,
Thank
you had
you,
your
Mike.
slides up. Did you want to get back to your slides? Where
No, I think we should do the poll about remission. I think
Okay, I'll send it
Yeah.
out. So what do you guys think about the word remission? Here's another poll. We have 56 people still with us, looking to get at least a 2/3 of an answer. Should we be using the word remission? Sometimes, never, it depends, I don't know. Show us what your thoughts are. We just reached the halfway point. Let's see if we can't get over. Yeah.
And we have some great comments in the chat as well about remission from Andy. Remission does seem to be a term that both science and medicine and lay people are already familiar with. Jose Souza said remission seems to give the impression that it's not permanent, so there might be different types of functional cures.
Yeah, so give us your vote. We'll be wrapping up the poll very quickly. Easy multiple choice. Yes, sometimes. No, never. It depends. Or I don't know. Oh, let's see if we can't get over to 40. We're 2 away. Give us your vote. We won't keep you beholden to it. One more person. One more. Give us a 40 at least. Come on. Put us over. 39 out of 50. Let's get one more person. Give us a choice.
All right, Michael.
Okay. Well, we stuck at 39. So here, I'll share the results of what we had. So you can see overwhelmingly,
Yeah.
people said yes.
Mhm.
People said yes.
Great, thank you for sharing. So Lynda and I wanted to wrap this up with potential ideas for how to advocate for terminology. Lynda, do you want to go through these points?
Yeah, you know, in other words, it's nice to have had this conversation. So what do we do now? And I'm like let's just do it, girl. So this is what I came up with for people to push this forward. So I think that I'm not sure. I mean, based on what we have, it sounds like we should not use sterilization, and that maybe drug-free remission is acceptable. So anyway, I think that we need to let the researchers know when they're using the wrong terminology. So how do we do that? You know, in other words, you need to, when you're at, this is not what I wrote.
Yeah, Karine, you have to advance the slide to hers.
Yeah.
Oh, skipping that. There you go.
Yeah, okay, great, thank you. Yeah, you know, so if we're this is gonna be an initiative for us, we have to let everybody know that this is an initiative for us. And that includes the CABs that we belong to and other community organizations that we interact with. I mean, whenever this comes up, and, you know, make it come up in forums where cure research or research generally is discussed. And then raise these questions with researchers, with government, at drug company meetings. I mean, not just within our own bubble, but with other stakeholders that, you know, for whom this is just as important as it is for us. So I think it would be really important for us to keep each other informed about our progress. You know, researchers have rebelled against this and they never are ever going to change their ways. Well, we know that's not true. But I'm just saying, you know, if you can get back to us, Karine and I, and just let us know if your community likes remission or they're against it. I mean, I think the sterilization aspect of it is so derogatory and frightening that that's not going to be as problematic. The other's a little bit more complicated, but, you know, we need to hear from you in the future about your progress of pushing this through with other people, other stakeholders. And, you know, when something that's been effective for old time activists like me forever is if, you know, a researcher says something that you don't like, go to the microphone and say so. I mean, you don't have to, you know, be spit and fire. You just have to say, you know, it's really unacceptable for us to use sterilization, you know, for you to use sterilization. And you'd be surprised how that little bit of, oh my God, here she comes again, will make people change their ways and do things differently. So, and really, if you could come back to us with, you know, the different sorts of reactions you've gotten from this or different ideas you have, as a result of hearing this or talking to your community about it, or other terminology that you think is appropriate. I mean, I'm sure that Karine, our, as I said, our resident social scientist maven, will, get some papers together. We've already done some that address this stuff, but I mean, if we really want to do a big push, as I alluded to before, we need to have this kind of stuff published so that, researchers can take a look, and, the journals are their Bible. So if they see that, okay, wait a minute, this is not acceptable, this is what we should do. And then if they read about it in their medical journals, we're halfway home with convincing them. So if you would, Michael, how would you suggest, I mean, we talked about this, but that people keep in touch with us about what luck they've had about sharing this with their communities and other researchers and stakeholders?
I will put that in the subsequent email that we will send out to everyone who registered. So that way people will get that. Right.
And we really, again, Michael, want to thank you for helping us make the slides sing and dance and not just be boring.
Thank you. And thank you, Karine, as well, for the presentation. I wanted to point out to everyone before we end today that we have a feedback form, and there will be another raffle. We have 5 $50 Amazon gift cards. If you fill out the feedback form, you'll automatically be entered in the raffle. And so that will be a way for doing that. I will also share that link through the email. But again, I'll put it in the chat there if you all want to do it, if you have time right afterwards. Sometimes filling it out right afterwards is great. We will be collecting answers for 2 days after this, and then we will close the ability to give feedback. And we will close things there.
I see a hand from Rowena Johnston really quick.
Yes, go ahead.
Rowena?
Yeah, I'm sorry I came so late to this game. It occurred
That's
to me,
okay, welcome.
Shuyu and I have been talking about terminology, actually. And I wanted to run this by you just in case you like this, that this phenomenon where people are able to, well, I'll just say it, the terminology we came up with is HIV clearance. And I don't know if people like that one.
That's a good one.
Yeah.
And then, maybe if people still, so that's obviously when all these replication competent viruses are gone, right? That would be HIV clearance. And then maybe if there is still some virus in there, it could be drug-free control. Like
that clearance is excellent, an excellent suggestion, Rowena.
All right, thank you, Lynda, and everyone.
Yes, and I just wanted to add my thanks to this. We've went a little over time, so thank you for sticking with us. You are very dedicated people. We will be posting the recordings of these sessions online. I will be sharing those links via the email, so if you registered for today, you'll be getting those sent directly to you. I'll also try to include a lot of the things that were shared in the chat, so expect an email sometime later today or perhaps tomorrow that'll give you all of these. Don't forget that we also have March 1st in the works, which will be our post-CROI community event where we will have scientists who are going to be giving us the feedback directly from CROI of what they thought. I put the link in there as well, so you can see that, but I will include that in the email. Everything will be in the email, so be on the lookout for that. I'll put in the feedback form once more if you want to give us that feedback and enter the raffle. Thank you very much, Danielle. Mwah. Thank you. Wonderful job. All of our presenters, if you're still around. Mwah. Thank you. Our panel, all of this. And thank you all for taking the time to share your thoughts with us. I hope you found this edifying and lovely as I did.
See you guys next time. Thanks to everybody.
Yes, thank you. Take care.
Thank you all. Great seeing everybody.
Yeah,
Likewise.
really. Thanks, everybody. This was great. Appreciate
you.
all of your feedback on this last presentation.
Yeah, thanks, Michael.
Danielle, will you call me?
Yes, I will.
Thank you.
Thank you very much.
Good to see you, Lynda.
Thank you.
You
Be
too.
well.
Take good care.
Thank you,
Alrighty, bye-bye.
Phoebe. Yes.